Remove the central pin. Select the reamer based on the medial to lateral mapping point and ream down until the guide pin is caught into the window. The depth of cut here is approximately 2 to 3 millimeters, and repeat for the anterior circle as well. Choose the proper femoral sizing trowel. It is marked P for posterior, and insert it into the prepared space. Again, check that you are flush or slightly recessed at all edges, anterior posterior and medial lateral. Once fit is confirmed, we begin preparation for the taper post. Advance the taper post drill to the laser mark and leave in place. Reinsert the 2 mm femoral pin and securely seat it with the mallet. Rotate and remove the trowel handle. Advance the femoral step drill over the pilot drill. It will automatically stop on the taper post drill. Advance the tap. The tap should be stopped when it is flush with the back of the taper post drill within the cannulation of the tap. Remove the tap. Remove the drill. Insert the taper post implant into the trowel handle Morse taper and advance over the guide wire. Dock the taper post implant and handle onto the sizing trowel. The screwdriver is inserted through the handle and is advanced until the depth stop on the shaft stops at the back of the trowel handle. Remove trowel handle and remove the guide pins. A placement gauge can be used to check the depth of the taper post in relation to the femoral trowel to ensure that the taper post will engage onto the articular component. Remove the sizing trowel. Next is the tibial implantation. Advance the suture retriever through the tibial hole and out through the plateau. Retrieve the implant sutures and pull the final tibial implant into the prepared socket. Using a slot driver, you can control the orientation from the underside of the tibial implant. Keeping traction on the sutures, we assemble the Arthrosurface cement ejector, which is done by putting low-viscosity cement through the funnel and into the syringe. Insert the yellow plunger so that it is flush with the back of the syringe, and insert the syringe assembly into the ejector handle. Attach the drive rod to the handle, and attach this to the handle using the J-lock locking system. The sutures are pulled through the glue shield, and the glue shield is inserted into the distal tibial drill hole. With one hand on the handle and the other on the power drill, pressurize the cement to the underside of the implant. While backing out the tibial hole, you should see the implant rise 1 to 2 millimeters, and then press on the top of the implant using that force to interdigitate the cement into the cancellous bone of the tibial plateau. Continue to inject the cement and remove the cement shield. Open the articular component for the femoral side, confirm the orientation is correct with the P laser mark indicating posterior, and apply pea-sized amounts of cement to the underside of the implant. Use the impactor and mallet to seat the final implant and remove any excess cement and all osteophytes. The Arthrosurface UniCAP procedure is now complete.